Totally. Thousands of % different than what we were told we needed.
Same thing, exactly.
Yeah. You had also talked about how B12 can assist with vision problems.
Well, again, because, when people think of nerves, they kind of think of just like your arms and legs, your spinal, area. Nerves are all throughout our body. There's nerves that innervate the stomach, the bladder, okay, all over your body. And people who have true B12 deficiency can have optic neuritis or optic atrophy. You can actually destroy the nerves of your eye. So, even though nerves are all throughout your body, absolutely with the vision, you need nerves with that. So when you have a B12 deficiency, again, it's that myelin. And if that myelin is attacked, that's a fatty substance that it doesn't transmit properly, people get peripheral vision loss. You can actually have blindness from B12 deficiency. So that's why, elderly people, again, they could have like macular degeneration, this or that. A true story, my husband's grandmother was in her late 80s, and she probably was, I think at the time, 86. And she had to go in for surgery for like macular degeneration. They were watching one eye. Well, at the time, we told her, you got to get yourself B12 tested. She lived in a different state. So she went to her doctor, and he went, you're fine, Mary, because her blood count looked good. But she was deficient. So anyway, we said, what was your level? And it turned out he never tested her. So then she said, my grandson's a physician, really. So he did it as a courtesy, tested her. Well, then he was embarrassed because she came back deficient, okay? So she got the series, taking the hydroxycobalamin. This is just to show you. She was a diabetic and gave herself insulin. She decided she was going to give herself her own B12 injections because it was more convenient, and somebody tried to charge her $15 for every injection. So she figured, I give insulin, I know how to give it. So she'd give herself regular B12 injections. When she went back for her 3-month checkup of her eye, the ophthalmologist was like, whoa, like you don't need, your eye is cleared up. Like she couldn't believe it. It was the B12. So, maybe when they're giving visual tests, that's another thing. Absolutely another good study for ophthalmologists to do. People with macular degeneration or anything with the retina. You got to remember, diabetics are high risk for B12 deficiency. Patients who are diagnosed with MS get optic neuritis, optic atrophy because of the nerves, because of the myelin. And elderly, they should always be checking patients for B12 deficiency.
There are people that have to rebuild their storehouse of B12 levels. Yet the B12 injections, they go out of your system within 24 hours out your urine. So how do you build your storehouse of levels if you're excreting it every 24 hours?
Well, just like a pill, like you take something in, you excrete it. That's why people take daily pills. That's why taking a shot once a month just doesn't do it. Okay? When you're that deficient, what happens is you're trying to help your nervous system, your myelin, et cetera. That's why they give you, you're so low that, and some physicians do this, which is a mistake. Say they find someone to be B12 deficient, they'll give them a shot, and then they want them to come back in a month. Maybe you're so deficient, maybe you don't even really even feel that much better. You feel like a little better. But you need to give more to kind of
jumpstart the body?
Yeah, I guess in a sense. Okay, and to help like the nerves, or what you're also trying to do, you're trying to repair any kind of damage or that myelin, that anything that's happening is to give the body B12 of how the body repairs itself. You're giving back what is needed.
What about how much of the B12 injections are absorbed versus excreted? Can you share about that?
I don't, it depends on probably where they say that your liver retains B12, and this is where I think the vegan and vegetarian community gets a little confused. They did research way in the early 1900s of the metabolism of B12, and then your liver kind of stores it, and that's why people can live for a long time. That why they're trying to rebuild your stores is that way if you need some, then the liver will kind of give a little bit out to the system. But what we know, maybe that's for life and death, or people who are, starvation camps, etc., that maybe it takes you a long time to die from a B12 deficiency. But you got to remember, when you're getting up to that point, these people have a lot of nerve damage, or they're going to have some brain problems, etc. So maybe it looks theoretically on paper, and they were able to study these people back in the day when they didn't have B12 and showing. And theoretically, yeah, maybe there's a little B12 that they put out so you're able to kind of, the body knows how to conserve, like so you won't die, but it's not good for your system. So to say how much is stored in and how much you use, and again, there's so many different factors. For instance, we know people who have liver problems, people who are alcoholics, people who have hepatitis, say even liver cancers, they may have a higher reported out serum B12. It's a fictitious because the liver is involved in transferring the B12 into methylcobalamin, the coenzyme that your body needs. And when you have a faulty liver, it may not be able to convert it out or for you able to use it. So there's other people, that's why B12 is very complicated. And so when a physician looks at a B12 and you see, like, say, 600 and they got a liver problem, that's going to be fictitious because it has a different meaning.
Okay, I hear you.
You would treat. So there's other little things we haven't talked about. There's different circumstances. So a lot of physicians, when someone is very deficient, like say they get down into like 130, 120s, a lot of times they'll give daily injections sometimes for 2 weeks, and they'll definitely give like a shot every week for 3 weeks. This is even in the literature. They'll give a shot because they're trying to repair what they can. You know, after 6 months of therapy of high-dose B12, you'll kind of know where you're going to be post-injury. These are people who were misdiagnosed, and then they kind of finally, somebody did the B12 and went, whoa, this is what your problem is. So retaining and storing, that's why the method of taking a sublingual B12 daily kind of makes sense. And that's why a lot of people will benefit from that. There are those people, maybe 15, 20% that will do better on injection, or they swear by them, they feel better. You wonder, why is that? And that's what really needs to be researched. The question is, there is such a thing, this is a little bit complicated, where there's like 10 to 16% of the population have an inborn error with homocysteine. Homocysteine can be very elevated, and the full expressed genetic problem can cause mental retardation in children, and it causes severe vascular, like clots. They can get strokes in their brain, et cetera, because the homocysteine is too high. But it's an inborn error, and it's rare. But we know 10 to 16% of the population have a slight defect of that gene, and what happens with them, they don't have the full expression, but they get vascular disease earlier in their 30s and 40s. That's why they check for high homocysteine in the blood for heart attacks, strokes, blood clots in the lung, in the leg. And when you have an elevated homocysteine, you make clots. So these people have a tendency to have a predisposition for vascular disease earlier because they have a partial defect. The question is, are these people that do better on the injections and more frequent injections have a defect in the B12 metabolism? And we know there are inborn errors of B12 metabolism in infants and children. So maybe these people that do better on injections and more frequent have a partial defect in that gene. That's something that needs to be, evaluated and looked into.
I want to bring up something controversial, if I may. In one part of the book, you wrote about how you and your husband feel that for people who have a B12 deficiency, to get flu shots or to get any type of vaccinations, that it's unethical. You didn't say unethical, but it's wrong. Well, I think it's wrong for other reasons, basically because there's a form of mercury in these injections, which is terrible for you. But tell us why you feel this way.
Well, because I read a good article published in a scientific journal, and it stated they tested elderly people that they gave the pneumonia vaccine to, and the people who were with the lower B12, which we would consider deficient, like under the 350, and people who are B12 deficient, they didn't respond to the vaccine because their immune system was suppressed, so they couldn't make the antibodies to protect them against pneumonia. So the point is, if we know that's true, and it was a good study, and they reported it, and it's reported all over the place, if we know that's true, you're not really protecting that patient, okay? B, you're wasting money giving them a vaccine. And the most important thing is that person you're giving them pneumonia so they won't get pneumonia, but it didn't they didn't have enough health or body strength. Their immune system was suppressed because of the B12 deficiency. They couldn't produce the antibody response, so it didn't protect them.